I'm Angela Smith, Doctor of Physical Therapy over here at Custom Physical Therapy. And today I was going to talk to you about diastasis recti. For those of you that have never heard of that, it's just an ab separation. So it can happen to anyone, men or women. Usually it's because of pregnancy, but if you have a lot of weight gain where you get a lot of abdominal fat, then it can cause that separation between the abs. It affects your rectus abdominis muscle, which is that six-pack muscle there in front. And you have a line down the middle of connective tissue called your linea alba. If it gets stretched out, like during pregnancy, you can get that separation right along that line. It actually happens to 100% of women that go to end of their third trimester. They get some sort of ab separation. But 60% of women, roughly, will still have that problem postpartum. And so like 6 weeks after having the baby, they still have like a separation. So I'm going to teach you how to test for that to see if you have a diastasis recti. And then I'm also going to talk to you a little bit about exercises to avoid and even some exercises that you can do in replace of those exercises that you shouldn't be doing right now. Okay, I'm going to show you how to test to see if you have that diastasis recti. So I want you to lie down on your back. You can keep your knees bent. And you're going to find the middle of your stomach, just where you picture that six-pack muscle coming together. You can have an ab separation anywhere along that rectus muscle. So some people may have a bulge up higher towards the ribs, because that rectus abdominis muscle inserts up onto the ribs and then goes all the way down to your pubic bone. So some people may separate lower, and then some people separate more around the middle. So as I do a little bit of a crunch, I feel along my stomach. You can start at the belly button and work your way up or work your way down. And if you can put your fingers in between those two muscles, then you obviously have a gap. And then to measure it, turn your fingers perpendicular to that linea alba, or that middle line, and see how many fingers you can fit in there. Just gently. You shouldn't have to push hard at all. You're just gently going in there and you feel, do I have a 1 finger gap? Do I have a 2 finger gap? Do I have a 3 finger gap? And if you have more than a 2 or 3 finger gap in between there, then there are certain exercises that you definitely should avoid so you don't make that worse. So exercises that you want to avoid when you have that ab separation are things that are going to contract that rectus abdominis, or anything where gravity is going to cause everything to fall down onto that weakened area. So that means we want to avoid any crunches, any sit-ups, anything where you're doing a trunk flexion exercise down on the ground, or anything where you're prone on your hands and knees, like a push-up, like burpees. Those are the kinds of exercises that you should avoid. So instead of doing a burpee, you can just stand in place and do a squat. I know my friends over at the studio here in Logan are really good about giving you modifications for certain exercises. And if it happens to be an exercise that I just talked to you about, then take some of their modifications or do some of these things that I'm going to show you. So instead of a burpee and getting down on the ground, causing that strain on the stomach, you can just do a stand in place squat. I know Shar at the studio, a lot of times will show you this one where you can just keep your arms up in the air, which activates your core, but in a safe way. So we're engaging that core, keeping it tight and pulled in, and lifting that, your alternating knees lifting up towards your chest. So we're okay to activate what's called your transverse abdominis, and that's actually what we want to engage more when you have that diastasis recti. Your transverse abdominis is this muscle that's the deepest of your core muscles, and it wraps around like this, and it's like a corset, so it tightens everything in. And you want to think about drawing in your stomach and keeping that tight anytime you're doing some kind of core work and to help pull that separation together. Instead of a push-up down on the floor where gravity is going to affect your stomach and cause everything to shift down into that weakened area, you can just do a wall push-up. You can put your hands on the wall, you can slide your feet out just a little bit, and then do a push-up along the wall, which it won't be as much resistance, but it also will put your stomach in a much better position to avoid straining that diastasis. So when we get into doing floor work, we want to avoid push-ups, burpees, mountain climbers, anything where we're going to be in this position. That's a no-no. If you're doing planks, you can do a side plank and still be safe with that diastasis. So if you're wanting a replacement for the plank exercise, you can do a side plank. If you're doing mountain climbers or any of those other exercises in that position, then you can do just a standing exercise. If we're talking about core work on our back, we don't want to do anything that's a crunch. That means no bicycles, none of the pike things, anything that's going to cause that flexion of that rectus muscle and the contraction this way. So a replacement is to engage that transverse abdominis during any exercise that we do while we're on the floor. So it's okay to add in leg stuff while you're engaging your core. You want to contract that transverse abdominis, pulling everything in tight, pulling everything together and that belly button in towards your spine, and then also maintaining a pelvic tilt. A pelvic tilt is flattening your back into the floor. So we all have that natural rounded arch in our low back, but we want to eliminate that arch, press it into the floor, and keep that lower abdominal muscle engaged and stabilize our back as we also activate that corset type transverse muscle, and then we can add in legs. If you have a diastasis recti, you need to start small. You want to start strengthening that core and working that transverse abdominis. And if you have any more questions about exercises that you think may or may not be good, you can always message me. And I'll do another video teaching you about how to treat your diastasis recti. Thanks for watching. Hopefully that was helpful to someone out there. And if you want to follow me, I'll make another video about how to heal that diastasis recti and give you a progression of exercises where to start and how you can challenge those a little bit more to help close that gap and bring those stomach muscles together.